Dr. Hannah, are you there? Just give me a sec. I'll share my screen. Hello, Dr. Hannah. Can you hear me?
Yes, doctor. Am I audible?
Yes. So this is your case and your 2-minute starts now. Can I start?
Okay. Hi, Jennifer. I'm Dr. Hannah, your GP for today. How are you doing today?
I'm okay, doctor.
That's good to hear. So, Jennifer, from the notes, I can see that you are here for the routine checkup and you would like to know about the DPT vaccine. Is that right? Is there any other concerns that I should address in this appointment?
Yes, doctor, you were right. I want to know about the vaccine and I'm also concerned about because I'm 20 week pregnant. So is it safe during the pregnancy and what happens if I'm taking vaccine? So my baby will be protected as well?
I totally understand your concern, Jennifer. I would definitely address these things in this appointment. So before I start, I would like to ask you further history from you. Is that okay with you? Sometimes these questions can be a little bit personal and sensitive, but I'll make sure everything will be very confidential. It will stay between me and you only. Is
Okay,
that okay for me to proceed? Okay.
sure.
Thank you, Jennifer. So, Jennifer, I can see you are 20 weeks pregnant. So, how was were you up to date with the antenatal checkup so far?
Yes, doctor.
All right. Any concerns with the blood investigations or ultrasound reports done so far?
No,
All right. Are you having any sort of contractions?
no, doctor.
All right. And have you done the Down syndrome screening?
Yeah.
And was that normal?
Yes, doctor.
All right. And were you taking folic acid in the first part of your pregnancy?
Yes.
And have you started feeling the baby kick?
Yes, doctor.
All right, that's good. And how about is this your first pregnancy?
Yes, doctor.
Sorry,
This is my first pregnancy.
this is your okay. All right. So, any medical or surgery history like high blood pressure or high sugar levels before this?
No,
Anytime? No. All right, that's good. And have you noticed any swelling of limbs, blurring of vision, or headache?
no, doctor.
All right. And okay, so how about your vaccination history? Have you been vaccinated during your child? Were you completely immunized during your childhood?
I think so, doctor. I can't remember now.
All right, I understand. Uh, Thank you, Jenny, for giving me all the history. So, regarding the pertussis vaccination, so like you are concerned, it's like the live vaccinations are completely contraindicated during pregnancy. So, vaccinations are. So, let me ask you one thing, Jennifer. How much do you know about the immunization or vaccination?
I don't know anything, doctor.
All right, please don't worry, I can help you with that. So basically, by immunization, what we are doing is that we are introducing some sort of inactivated microbes or killed microbes against certain infections, so that when the body gets infected with these microbes in sometime in future, the body can easily produce antibodies or produce immunity against these infections. Are you with me so far?
Yes, doctor.
All right. So the important thing is that during pregnancy, the immunity will be less. So during that case, we can't give live vaccination. So we can't give live microbes, live those vaccinations containing live microbes during that pregnancy. But coming to the DPT vaccination, it is safe. Like it doesn't contain any live component, so it is safe and it is highly recommended in the third trimester of your pregnancy. I can see you are only 20 weeks. Maybe after 28 weeks, it's advisable to take a DPT booster. Are you understanding me, Jennifer?
Yes, doctor.
All right. And apart from the DPT booster, I also recommend, have you taken the influenza vaccination this year?
No, doctor.
All right. So it's also recommended to take the vaccination, and it's also safe during pregnancy. So yeah, and like you asked, the DPT booster and the influenza will be giving immunity to the baby till they are able to take their own vaccination. Have you got any questions for me?
Anything else that I need to know, doctor?
Sorry.
Anything else that I need to know?
Oh yeah. All right. So like these vaccination, like any other medication, vaccinations has also got certain side effects, but they are just minor side effects, like maybe some local reactions. Have you got any allergies before with any vaccination?
No, doctor.
All right. So what I was talking about is maybe minor local side effects, like maybe irritation or pain in the injection site, but you can take a Panadol be a big
Okay.
issue. Yeah. And yeah, that's all you need to know about.
So, doctor, you like if I'm taking vaccine now,
Mm-hmm.
so my baby needs to take the vaccine again.
Yes, exactly. The baby needs to take vaccine, but till the age baby take the DPT vaccine, he will be protected. That's the importance of this vaccination. But the baby definitely need to take the vaccination according to the immunization chart or according to the blue book.
Which other vaccine that I can take, doctor?
Uh, DPT booster and influenza is the vaccination which is safe in pregnancy, but all other live vaccines are contraindicated. Just those two is enough.
Any other thing that I need to know, doctor?
Yes, apart from this, your routine, please continue with your routine antenatal checkups, and I would advise you with certain lifestyle modifications, like please follow a healthy balanced diet with good amount of fluids and vegetables, and also try to do exercises every maybe upper body exercises, 30 minutes, 5 days a week, and yeah, avoid foods like uh, no, you're already 20 weeks. Uh, yeah, that's all you need. I don't know, doctor.
That's okay. So
Can
you
I
want to
start?
finish? Yeah, that's okay.
Okay.
So
Yeah.
still you have time. It's almost 1 minute. Um,
But I don't know what to add. This case
that's
is very
okay.
new to me.
Dr. Hannah, it's really nice performance. Like you have very good approach. So coming to
Thank
the
you.
content, like how you explain, like how you took history, that was nice because you need to take just a very short history, like 1.5 minutes. That's enough. But you need to spend more times on counseling. In
Yeah.
here, so like we can answer the question like yes or no, and we can answer like elaborately because your part is counseling. So look, you still have enough time, so you can talk more.
Mm-hmm.
And your patient has no idea about what is whooping cough, what is like pertussis vaccine. So you can
Okay.
explain them about condition, what happened if we are not getting vaccine, what could be the complication, and timing of the vaccine is important. You didn't mention about the dose. And
No, I
also,
just
like,
said booster.
yeah,
Yeah.
side effect you mentioned, that is okay. So here, you explain like your patient baby also needs to be vaccinated when the baby will born. Other thing you should also mention about the family member. Okay, so all the
Mm-hmm.
those family member needs to be vaccinated. Another thing, your patient asked like any other vaccine that you would recommend during the pregnancy. So there are three vaccine that is safe during the pregnancy. One is
Mm-hmm.
like pertussis, influenza, and third is COVID. Okay,
What was the last one?
COVID-19.
COVID. Okay, yes.
Okay,
Mm-hmm.
so let's discuss the case. A pregnant lady, Jennifer, at her 20 weeks, came to your GP clinic regarding whooping cough advice. So she had whooping cough last pregnancy inquiries if she needs any pertussis vaccination and any other vaccination for her pregnancy now. So task is taking history and counseling. So in this case, like as I mentioned, history you can cut short just a very quick history regarding her antenatal visit, ask about any concern. So first trimester question you can ask about have you done your first antenatal visit? What about your blood test report? Did you take folic acid? Any bleeding, tummy pain? Any issues at this moment? Is it your first pregnancy or what number of pregnancy you can ask? Any specific concern for today's consultation so that I can address. So patient is coming for that vaccine. You can still ask about that whooping cough symptom. Okay, so ask about any cough, cold, runny nose, fever history. Any previous whooping cough history, anyone in the family isn't sick currently, ask about it. Any vaccination allergies, past medical history of anaphylactic reaction, SADMA, just a quick general health question. Coming to the whooping cough, as I mentioned, so your predominant assessment area is counseling here. So you spend more time on counseling. Um, in here, you can start explaining about condition, clinical feature, course of the disease. So, condition whooping cough, also known as a pertussis, is a highly infectious bacterial condition that is spread like when an infected person like coughs or sneezes. Okay, and basically it affects the lungs and the airway, and it can cause like very the person who might affect with that pertussis. So it can cause like terrible coughing, making it really difficult to breathe. And people who are not vaccinated are at high risk of catching that infection. Okay, so clinical feature you can mention like it can cause like blocked or runny nose, sneezing, definitely terrible coughing. Fever can happen, and basically the worsening thing is the cough, and sometimes like that cough is so bad that can be followed by vomiting, choking, or like whooping sound can happen. Okay, and for the newborn or for the babies, like it can cause like stop breathing and turn blue. So course of the disease, definitely it can be serious for babies, and whooping cough can cause serious complication including like brain damage, pneumonia, sometimes death. Okay, and babies under like 6 weeks of age are too young to get that vaccinated against whooping cough. That's why we recommended mom to get that vaccine. Okay, uh, so pregnant women can protect their babies from whooping cough by getting that vaccine. So you can explain the most effective way to protect your young babies from whooping cough is for you to be vaccinated during the pregnancy. And when you get that vaccine, so you can pass that protective antibodies through the placenta to your baby, and that protects them in their first few months of their life. And they're definitely that time they're most vulnerable because their immunity is still developing that time. And vaccination during pregnancy is very effective. So just mention timing of the vaccine. So it's just a single dose during 20 to 32 weeks in each pregnancy. And whooping cough vaccine can be safely given at the same time as an influenza or COVID-19 vaccine. What could be the side effect? So always remember for vaccination counseling case, side effect could be your another key point you need to mention. Just mention whooping cough is not a live vaccine, so definitely safe in pregnancy. And if studies show like no increased risk of complications such as like stillbirth for pregnant women, so that is less likely. And for that vaccine, what can cause, like it can cause some pain, redness, swelling, what the vaccine is given. Sometimes can cause like muscle ache or the fever. However, like you can explain those side effects could be minimized by taking like paracetamol or just having enough fluid and rest. Okay. Your patient might ask, like, doctor, is the whooping cough vaccine free for pregnant women? You can say yes. So, according to the National Immunization Program, it's free for pregnant women. If your patient not ask you, you can give that question. You can give that answer like voluntarily. Okay. So, good thing is that is it is safe or and definitely it's free for the pregnant women. Your patient might ask, like, does my baby still need to get vaccinated if I get vaccinated in pregnancy? Yes. Your baby still need to be vaccinated against whooping cough according to the National Immunization Program. But that vaccine against whooping cough at 2 months can be given from 6 weeks. So before that 6 weeks, if you get that vaccine and you can pass that antibodies through the placenta to your baby. Okay, that's why it is highly recommended for getting that vaccine during the pregnancy. Should my family be vaccinated? The most important person in the family to be vaccinated, you can mention in this way, like because close family member advised to be vaccinated because that can give the highest protection to your newborn baby. Okay. Um, Vaccination of other family member does not provide your baby with protective antibodies, but that can protect them and minimize the chance of bringing whooping cough infection into the home. Okay. Um, so, important question your patient might ask, like, doctor, what other vaccine could be recommended during a pregnancy? So, definitely, influenza vaccine and COVID-19 vaccine are also recommended, and those are also free for pregnant women as well. So, that's the case for whooping cough vaccination during pregnancy. So if your patient had a whooping cough in previous pregnancy, you can still give like single dose of vaccine during each pregnancy. So the dose would be single dose between 20 to 32 weeks in each pregnancy as per the guideline. Okay. If your patient asks, doctor, I don't know anything, definitely you can explain because sitting awkwardly like 1 to 2 minutes is not good. Rather than like if you are explaining from the disease and how can we prevent the complication and minimize those things, it would be like definitely nicer when you are going to explain in this way. Um, as I mentioned, family member also, like, you can advise to give them the vaccine, because vaccination of family member can protect them and also minimize the chance of bringing whooping cough infection into the home. Because as I mentioned, before 6 weeks, newborn immunity is not fully developed, and it's if anybody's sick at home, so newborn can easily catch those infections. Okay. Okay, so who will be the next one? Um, Dr. Rian. Dr. Ian Carvalho, are you there?
Hi, yes, I'm here.
This is your case, and your 2 minute starts now.
Okay.
You can start.
Hello, Georgia. My name is Jan. I'm one of the doctors of this clinic. Uh, Very nice to meet you.
Hi, doctor.
So I can see here from my notes that you came here to get to know the results of the blood test that you had last time. Is that correct?
Yes, doctor, your colleague ordered blood test. Actually, I want to know, is everything all right, doctor?
Yeah, everything looks roughly normal, nothing concerning at the moment. Your hemoglobin is a little bit low with an indication of anemia. We might have to do some further tests for this to check your iron levels and things like that to see the cause of this anemia of yours. But that's nothing concerning at the moment. It's not gonna cause you any issues in the short term. All right. Your white cell count, which is basically a marker of inflammation infection, is normal. Um, your platelets, they seem to be normal. Your electrolytes, like the sodium, is also within normal limits. And the tests that indicate the function of your thyroid gland, which is the gland that sits in front of your neck and regulates the function of everything in your body, is also normal. Your cholesterol, in the other hand, is a little bit high. I'm not surprised by this result because that's something that is very common in your age group. And it's possibly something that we can treat with some lifestyle modifications, especially if we introduce some exercise and some changes to your diet. Do you have any questions?
Okay, so what sort of diet do you advise?
Yeah, so before we discuss what we're gonna do in regards of your diet and everything else, is it okay if I make you some quick questions to you?
Sure, doctor.
Okay, so last time that you came here, you said that you had something wrong with your nerves. Can you elaborate this to me, please?
Yes, doctor, I don't feel like uh, I'm well actually. Like I feel like I'm having some issue with my nerve. I'm not 100% sure what's wrong with me, but I'm not
Mm-hmm.
100% actually.
Okay. And having something wrong with your nerves, do being more anxious or jittery?
Yeah, doctor, more like I'm feeling anxious.
Feeling anxious. Okay. And for how long have you been feeling anxious?
Maybe like couple of months. Not sure, doctor.
Mm-hmm. Do you feel anxious most of the days?
Yeah, like
Mm-hmm.
I don't feel well actually.
Mm-hmm. Okay. I suppose that this can be quite distressful for you. Anxiety is a very displeasant feeling. I might have to ask you some further questions about this. I would just like to reassure you that everything that we discuss here is between you and me, unless you or someone else is in danger. Is that right?
Okay.
Yeah. So, um, you do you feel anxious about anything in specific?
Not really.
No. Is there anything that trigger your anxiety?
I don't know, doctor.
Mm-hmm. And you feel anxious most of the time?
Yeah, most of the time.
Yeah. How's your mood?
My mood is okay, but as I mentioned, doctor, I want to know is everything all right? You told me my blood test is okay, but yeah,
Mm-hmm. How's your sleep?
my sleep is okay.
Yeah, okay. And do you enjoy things that you normally do?
Yes, doctor, I do.
Yeah, okay. Do you have any hobbies?
Um, I have pet at home, doctor. Just my hobbies is just spending time with my pet.
Mm-hmm. Okay. Do you feel lonely?
Mm, no,
Mm-hmm. Any problems with work, if you still work?
no, doctor. I'm a
No,
retail person.
you're retired. And do you live alone?
Yes, doctor.
Okay. Do you have any family or friends?
Yes, doctor. My dog. I have one daughter.
One daughter. Okay. Does she live with you?
Lives nearby.
Mm-hmm. Okay. Um, all right. And do you have any medical problems whatsoever?
Yes, doctor. Like I have lots of medical issue.
Yeah. What sort of medical conditions do you have? High blood pressure, diabetes?
Yes, I have. Doctor.
Yeah. Okay. Any regular medications?
Yes, doctor, I'm taking regular medication
What medications do you take normally?
for blood pressure pill, diabetes pill.
Mm-hmm. Okay. And are you allergic to anything?
No,
Okay. I'm gonna have to ask you some screening questions. They might sound funny or odd, but again, they're part of the protocol. And just again, reassuring that our conversation is private. All right.
sure.
So, have you ever had any thoughts of hurting yourself?
No,
Okay. Um, have you ever had any thoughts of hurting other people?
no,
Mhm. And do you see or hear things that other people don't?
no, doctor.
Okay. Do you have any, do you believe in things that other people don't?
What do you mean?
Like, do you have any sort of religious beliefs that other people find bizarre? Do you feel persecuted? Do you feel that
Doctor?
people are after you?
No,
Okay. All right. Okay, so Georgia, um, it's not very clear yet what's causing your anxiety. So far, I think that it could be some sort of anxiety disorder because you feel anxious most of the time for no actual trigger or no actual reason. Um, but it could be other things as
your
well.
time's up, doctor.
Sorry?
Your time's up.
Okay.
Okay. What's your differential in this case? Do you have anything in your mind?
Yeah, so generalized anxiety disorder. Her TSH looks normal. I don't know what is the reference range of the thyroid hormones. Um, so I think that pretty much rules out any sort of hyperthyroidism. Um, could be depression, but she doesn't have any other positive findings for this differential. Um, PTSD, I couldn't elicit anything in the history, but I could have asked something more directly.
Yeah.
Uh, yeah, I
This is
gotta be
really
honest with you.
important.
I was a bit confused with this case because I couldn't elicit many positive findings.
That's okay. But you did it nicely. Your approach was really nice. So, like, look, when you explained the blood test, it was nice. Here, I think in the main exam, if you get like reference brains, that would be like much easier for you. But my
Mm-hmm.
advice for most of the people, like, try to have a look for common things like normal range, like normal values, because sometimes, like in main exam, you might not get the reference rate.
Yeah, I
So
agree.
T4, T3 is very high. Okay. Um,
Sorry, which one is very high?
T4, T3 both is very high level. Okay.
The 12.
T4.
Okay. The FT4 of 17.
Yes.
Okay.
Yes.
Okay.
And if you are still not sure, like as per the blood test, so start with history of presenting complaint, which you did. You already asked me about what do you feel, what do you mean by feeling like something wrong with nerve. But what I noticed, you didn't ask me any organic causes. Okay, so total organic part was missing. You more focused on like a psychiatric issue. So always ruled out first organic cause and then like
Mm-hmm.
try to ask about uh,
Yeah,
psychiatric issue. So for
true.
the organic cause, if you are still not sure what is the case, I prefer like
Mm-hmm.
ask about some chest symptom, definitely heart, neurological issue, lung
Mm-hmm.
condition, any like GI related issue. So just ask those things. You might get something positive. Okay.
Yeah. do a systematic review,
Yeah,
system review.
exactly. Okay.
Mm-hmm.
So it's not like all the things you need to ask, but at least like one or two questions. So at least you will get something positive.
Sure. And about her platelet count, is that correct?
It's not.
2.3?
So it should like normal range is 1.5 to
Okay.
4. So it's normal 2.3.
Okay. All right.
Yeah. And as I mentioned, like most of the time, like in main exam, you will get like reference range, but in case what happened if you will not get it. So that's why like just try to remember some day to day, like our some like common things, normal range. For example,
Mm-hmm.
hemoglobin, platelet, WBC, sodium,
Mm-hmm.
potassium level, thyroid, definitely, cholesterol level. Those are the common things. Okay.
Sure. Okay.
So let's
Thanks.
discuss the case. And another thing I want to point out, when you asked about past medical history, so try to ask like, because in AMC clinical exam is a bit of like weird exam. Unless you ask, like you should ask your patient definitively, for example, like, do you have any heart related problem? And then you will get the positive findings. Okay.
Okay.
If you ask me, do you have any heart related problem? I would give you like something positive.
Mm-hmm.
So
Mm-hmm.
let's discuss the case. You are at GP clinic, 72 years. Georgia came to see because she thought something wrong with her nerves. Your colleague ordered blood test in last visit. Today she came to your practice because of blood reports already done. So your task is interpret the report, take a focus history, and explain diagnosis and differential. So what could be your diagnosis and differential based on the blood reports? So it could be hyperthyroidism, subacute thyroiditis, Graves' disease, euthyroid 6 syndrome. It could be pheochromocytoma. Based on that history of presenting complaint, it could be panic, generalized anxiety disorder, excessive tea, coffee intake, infections, or postmenopausal. Patient is 72 years old lady. Definitely you should ask for some menopausal symptoms as well.
Mm-hmm.
Now, let's discuss about the blood test report. As I mentioned, like hemoglobin level is quite normal for this lady. WBC is okay. When you explain about the blood test, just make sure you can say like hemoglobin is one of the pigmented like protein that carries oxygen in our bodies. So it's normal. WBC, that fight against the infection, that is also normal. Platelet is helps to clot. So it's also normal. We checked your body some chemical, sodium, potassium, those things. It looks it's normal. We checked your hormone profile as well. So one of the hormone, we call it thyroid hormone, that like helps in our in our body's metabolism. So three things we usually check. One is like DHS, that is normal range, but what we can see, two level that showing that is really high, but your cholesterol level is bit high as well. I would talk later regarding your diet as well. So can I ask you a few more questions so that I can correlate your blood test with your clinical symptoms? You can ask about nervousness question. Ask about what do you mean by something wrong with nerve. Other, are you feeling anxious? Ask about onset, duration, how does it affect your life? So start asking question regarding organic. So anxiousness, nervousness, what could be the organic issue? Definitely first thing, it could be thyroid issues. Ask about weather preference, bowel motion, shakiness or tremor in your hand, eye problem. If you notice anything positive, you can ask other positive findings. But if you notice nothing positive, like three questions you ask, nothing positive, you can move on. Okay, no need to spend more time in here. But anything positive regarding thyroid, please ask details. For example, bowel habit question, tremor, any eye issue, any lump did you notice in your neck, any swallowing issue. Definitely ask about heart conditions. So chest pain, palpitation, short of breath. As I mentioned, patient is a postmenopausal lady. Ask about postmenopausal symptom, sleep, appetite, weight, those things. Differential diagnosis, pheochromocytoma. If you are thinking pheochromocytoma, ask about headache. infection, fever, night sweat, generalized anxiety. Do you worry excessively about things or any minor things? Panic attack, general question like past medical history, surgical condition, excessive tea, coffee intake, family history, especially thyroid issue or any cardiovascular disease, travel history you can ask. So in here, uh, for psychosocial history, I would say if you already get something positive organic, so psychosocial history, just ask about how's your mood recently, do you have enough support at your home, and uh, just 2 or 3 questions regarding psychosocial, and then you can move to that next. Okay. Physical examination is not your task. So if you're asking about any past medical history, so here past medical history, you should ask specifically. So do you have any history of high blood pressure, high cholesterol level, diabetes, heart condition? So your patient will tell you, yes, doctor, I'm having lots of condition and I'm taking medication for that. So patient also having heart condition, that is the rhythm problem, and ask about like any palpitation history, rhythm problem. Are you taking any medication? So your patient is taking amiodarone, okay, and recently increased the dose of that amiodarone. So this is the case of amiodarone-induced thyroid dysfunction. When you ask details about patient past medical history, you will get positive findings regarding heart problem, patient having atrial fibrillation, and for that reason, your patient is taking amiodarone. So that could be the probable reason for hyperthyroidism or thyroid dysfunction. So let's explain the diagnosis. Based on your history, blood investigation, I'm thinking your condition could be related with hyperthyroidism. So you can mention like in our name, there is a butterfly-shaped gland, we call it thyroid gland, and they produce hormone called thyroid hormone, which is responsible for our body's metabolism. Okay. I think this gland is very over-functioning and produce more hormones and disturb our body metabolism. That's why you feel like nervous, something not right, like nerve, you feel something with your nerve. And what I noticed, as you are having heart condition, atrial fibrillation, and you are taking amiodarone for atrial fibrillation, amiodarone that can cause like thyroid dysfunction as well. Okay, we call this condition is amiodarone-induced thyroid dysfunction. You can ask your patient, check your patient understanding in between, and I need to run investigation for my diagnosis. So this kind of condition can be caused, this type of like nerve issue could be other condition as well, like pheochromocytoma, which is a kind of tumor that produces hormone called adrenaline. But that could be less likely because you don't have any headache at this moment. It could be anxiety, panic attack, or excessive tea coffee intake, but those are less likely. Okay. If your task is explain the diagnosis, in that case, you need to explain like 5C approach. Okay. So 1C for condition, you already mentioned what is amiodarone-induced thyroid dysfunction. Another C for clinical feature. So symptom, it could be like related with unexplained weight loss, heat intolerance, or increased perspiration, muscle weakness, fatigue, lethargy, emotional lability, diarrhea, anxiety, nervousness, palpitation. And investigation of choice, definitely all the basic bloods, ABC, UC, thyroid function already done, kidney function test, LFT, calcium, magnesium, phosphate in can order, and scan wise, you can order thyroid ultrasound. Okay. Um, Sometimes like people might prefer to do like radioactive iodine uptake study, but that is not that useful in first instance. Okay. Um, if you notice any lump on the neck, you can still order biopsy of the thyroid gland. Um, And the management, if you are suspecting it's amiodarone-induced thyroid dysfunction, so usually like medical management and surgical management would be the last resort. But medical, what we can do, we can stop amiodarone, but you can say like, look, as you are taking amiodarone for atrial fibrillation, so definitely I would suggest you, like, I would refer you urgent cardiologist review for that amiodarone. Okay. And also, like, this patient needs endocrinologist review as well. If you mention if you are going to stop amiodarone, that is not the exact management. Definitely stop management, but at the same time, urgent cardiologist referral, because patient might need another like antiarrhythmic medication. Okay. Um, Sometimes like for this case, like anti-thyroid medication also recommended. So just you can say management part as a medical and the surgical, and also endocrine, like they can recommend about glucocorticoids as the first line of treatment, and ablation of that hyperfunctioning thyroid gland could be another option. Okay. So that's the case for amiodarone-induced thyrotoxicosis, or like amiodarone-induced thyroid dysfunction. So normal THS level, it should be 0.5 to 5, and T4 level, it should be normal like 5 to 12, and T3 level, it should be 1 to 2 to 2.8. Okay, so that's the case. Let's move to the next one. I already mentioned about that investigation. What investigation you can go, that is basic blood test and scan-wise thyroid ultrasound. But radio iodine, like radioactive iodine uptake, that is not the first line investigation. You can do later on. Another thing, if you notice any lump on the neck, you can order like biopsy. Okay. Um, My diagnosis here, amiodarone-induced thyroid dysfunction. So yeah, um, is most likely diagnosis. Let's move to the next case. Who wants to perform next? Dr. Gurstai, are you there?
Yes, ma'am.
Okay, this is your case and your 2 minutes starts now. You can start.
Hi, Jennifer. My name is Gostam. I'm one of the physicians in here. I'll be attending to you today. Very nice to meet you.
Hello, doctor.
Yeah, I understand that you're concerned about you're having pain. You've been having pain recently.
Yes, doctor, I'm having severe pain on my tummy, doctor.
I'm so sorry about that. I would like to give you a pain reliever. Are you okay with that?
Sure, doctor.
Okay. Is there anything else you'd like us to, is there anything else that's of concern to you that you'd like us to talk about?
Yes, doctor, what's wrong with me, doctor?
Okay, so from what we have seen from our investigations, um, we noticed that you are having a fracture in your ribs, and you have multiple fractures in your ribs. That's the bone on your chest, from the accident, and from the road traffic accident that you had, and also you also had a laceration in your spleen. Um, as a result of these, especially because of the problem in your rib, we are thinking that as a result of this, you are likely to be having pain as you're having now. And so one of the main management for that is that we need to give you pain relievers to make sure that you're not in pain. Otherwise, it could make you to start having problems with your breathing. And also, we noticed that you're having problems with you had a laceration in an organ called the spleen, right? It's on the left side of the upper part of your abdomen, and and we are thinking that perhaps we could manage you without doing a surgery. But from what I'm saying, it seems like we're not so sure of what is going on right now. And so we may want to do further investigations for you to be able to know if there is if the problem is getting worse, or if this spleen is if this organ called the spleen that has ruptured, if the wound in the organ is bleeding more, we may not have so much choice than to take it out. We so from what I've seen, from what we are looking at, we are likely going to uh, do more investigations for you. We would like to do check you again, do an imaging studies for you to see what is going on in your chest and in your abdomen. We want to check the lungs and see if the fracture in your ribs has affected your lung, because sometimes it might not show so much earlier on during the initial test that we did. So we want to do it again to be sure what is going on. So we want to monitor what's going on. So but before that, we would like to also initially we would like to examine you again, and then we'll do those. Then if we can do any findings we can find from our physical findings, then we would like to go ahead to do some imaging studies to be able to properly um, make a diagnosis of what is going on with you at the moment. So I'm going to, but meanwhile, I'm going to talk to my seniors, my senior colleagues, and the specialists in here, and the specialists to be able to, so that we can work together to give you the best care that is possible.
Okay, anything else that I need to know, doctor?
There is nothing at the moment. If at the moment there's nothing else, the only thing is that if we're going to we're going to talk to you once we are able to arrive at what we are going to do for you. Then we would like to talk more about the possible, if you're going to, there are options. We could go for surgery, right? So if we're going for surgery, then we'd like to talk to you more about the surgery. And so if we're going for surgery, for example, we'll have during the surgery, we'll have to take out your spleen, meaning that will also predispose you to developing some infection. And so it means that you may have to be placed on some, you'll have to be given vaccines like pneumococcal vaccines that will protect you against microorganisms that you'll be predisposed to as a result of the removal of your spleen. But we will not, I can't say right now if that is what is going to happen until we are able to conclude our investigations.
Okay, anything else, Doctor?
Meanwhile, we're going to continue our management with you at the moment. Nothing else.
You're disturbed? Okay.
No, no disturbed.
Okay, that's okay. You still have time, Doctor. It is your approach is nice. Doctor, I just want to ask you one thing. In this case, actually, you might get something like definitely observation chart, or like here patient complaining about increased pain. So you need to find out why your patient is having increased pain. Okay, CT abdominal given there is multiple refracture along with spleen laceration. So how you mention about the splenectomy, that is correct. So initially you need to mention about cause of the bleeding. So cause of the bleeding, it could be like multiple organ damage, but here CT scan showing there is a spleen laceration, and that is, I think that is the reason for maybe internal bleeding, and that could be the reason for his pain. Okay, so it's all about correlation and explain to your patient. When you explain about the management plan, you mentioned you are going to continue the current management plan. So what management plan do you want to continue? As a junior doctor, you need to explain to your patient that you are going to continue with the fluid, or you are going to give some blood to your patient if patient hemoglobin drop, or you are going to do surgical management. You mentioned about you are going to call surgical team. That was really nice. So just mention as per the surgical team, if they think spleen they are going to remove. So in that case, why spleen is important in our body, you need to explain as well. Okay, talk about splenectomy, long-term management. You mentioned about vaccine, but this patient also needs long-term antibiotic as well. Okay, so let's discuss the case. You are an ED HMO, 32 years female. Jennifer had an accident. So patient was retrieved and brought to the ED, primary survey done, reviewed by surgical team, CT abdo that showing that multiple refracture on left side and is spleen laceration. Decide to manage conservatively, but 3 hours later on, like patient complained of increased pain, and you were asked to review the patient. So observation chart are given, patient lying on the bed with a drip. So what happened, like observation chart given in that case, you get the observation chart, and if your patient hemodynamically unstable, you need to take the action. Okay, so your patient blood pressure is dropping. Your patient blood pressure is 80 over 60, heart rate is going up to 100. Okay, so in that case, like you need to mention about all the DRABC, you need to give like more fluid. So here just start with the painkiller. You can say like, Jennifer, I can see you are on pain. I'm really sorry for that. May I know, do you have any allergies? After ruling out any allergies, you can give pain medication. Okay, so as per the observation chart, as I mentioned, your patient blood pressure is falling down, heart rate is going up. So I'm a bit concerned about you might be like bleeding inside. So that's why what I'm going to do, you already notice patient having fluid running. So you need to put another cannula, like patient needs two cannula. Take necessary blood sample right now and send the sample at least VVG, and you start like a bolus IV fluid. Definitely call for help, call for your registrar, and just let me assure your patient that you are in safe hand and we'll try our best to help you. So what happened? Uh, as per the CT findings, what we notice there is like multiple fracture, and it could be like injury to the lung, spleen, or any other organ or blood vessel. As you had an accident, we have done CT like abdo showing that there is injury to the spleen, which I'm suspecting the most likely cause of the bleeding. Okay, for most of the time, like grief fracture, if it is not like, only the pain, we can manage conservatively. We're not going to do anything unless it can cause like pneumothorax or anything. But just a non-displaced like grief fracture, just conservative management with painkiller. Coming to the spleen laceration, so it could be the source of bleeding. So just mention spleen, why this is important. Spleen is that organ located left side of our tummy, and it is part of our immune system, and definitely it has multiple role. It filters the blood from the old RBC, helps fighting systems against the bug, and it is prone to injury during any blunt or penetrating trauma. Okay, so what happened? We are going to observe you uh, because we try to preserve spleen. Okay. So in your case, the bleeding reoccur and make your condition unstable. That's why, I informed surgical registrar who will take you to the operation theater. Surgical team, they might remove the spleen if that's the source of bleeding. We call that procedure is splenectomy. Okay, and surgical team might decide to do more imaging as well. Talk about splenectomy. So surgery is either keyhole or could be the open, and definitely it will be done under general anesthesia by experienced staff. And like any other surgical complication, I can tell you infection, bleeding, injury to other structure, risk of anesthesia, but this will be done by experienced staff. So this complication will be unlikely. Okay, but remember, this is another key point, like complication, surgery complication you need to mention. So what happens if you are going to remove that spleen? So body can live without spleen, but as it helps to fight against infection, so you will be at a higher risk of catching infection. That's why we can give you like vaccine for pneumococcal influenza, hip, and also you need prolonged antibiotic course to prevent infection. Okay. I can give you travel advice or travel breathing material after splenectomy. Other complication are clotting problem. You will stay a few more days in hospital, and other advice will be given by the specialist. But at this moment, we are concerned because your blood pressure dropping, heart rate increasing. So we are thinking still like bleeding happen inside your tummy, and probable source it could be the spleen. Okay, so online exam you will get vital sign, so you will get observation chart. Okay, and as per the chart you will take action. So for that case, if your patient hemodynamically unstable, if your patient having low blood pressure, a high heart rate, like tachy. So in that case, like definitely two large bore IV cannula and bolus fluid. If you notice fluid is running, just you need to make sure you need to give it bolus dose, not some maintenance. And if you're thinking it could be due to bleeding inside, just do a BVG stat, like check the hemoglobin. If hemoglobin dropping significantly, you need to do urgent blood transfusion. Okay. And that's why you need to take this patient immediately to the theater as well. Exactly. So resuscitation, admit, kneel by mouth, IV flow. Yeah, exactly. For online exam, you will get the observation chart. Okay, you don't need to ask about observation. Okay, so let's move to the next case. Who wants to perform? You can write your name on the chat box, please. Dr. Francis, Ansa, are you there? Hello, Dr. Francis.
Hello.
Hello, you want to perform?
Yes, please. I want to perform. Please
Okay.
forgive me if there's any noise.
So this is your case and your 2 minutes.
Okay.
You can sit here. You know there's another desk here too. Okay. Okay. Who best what's Nancy? Princess. Come and sit at the desk here. There's a desk here. Yeah. I'll bring the chair here. I'll bring your chair. Thank you.
You can start.
Okay, well, hello, Sonia. My name is Dr. Frances. I'm one of the GPs here. It's nice to see you. How are you doing?
I'm okay, doctor.
I can see from your notes that you've been through quite a number of ordeals, and I'm really, really sorry to meet you under these circumstances. But I want to assure you that whatever we discuss here is going to be confidential unless it's going to be harmful to you or to anybody. Is that okay?
Sure, doctor.
So, do you have any concerns today that you would want us
Yes,
to
doctor.
discuss?
I feel upset. Is it normal, doctor? Like, I don't know what to say, doctor. Recently, I had a big fight with my son. And, I didn't have any type of fight with my son before. Like, he was really supportive to me, but now, like, I'm really feeling upset, doctor.
So sorry about that, Sonia. I can understand that. I'm sure you didn't mean to have a fight with your son, but probably because of exactly what you're experiencing. So sorry to hear that. Sonia, please, can you, aside you being upset, how is your mood like?
My mood is, doctor, is not that great. Like, because, I just lost
Is it low? Is it high?
I lost my dog 2 months.
Yes, I can see that. Oh, so sorry to hear that. What about how you are sleeping? How is your sleep has been affected, or how you eat? How is it? How is it these days?
My sleep is okay.
Okay. So for how long have you been experiencing this, Sonia?
Um, I'm telling last few days, like maybe 2 to 3 weeks or so.
Okay. Is this the first time you're experiencing something like this?
Yes, doctor, because as I mentioned, like I had a fight with my son.
Okay. So Sonia, from the little that I've gathered from the information I have from your notes and also from what you are saying, I can say that your symptom may be as a result of what we call depression. Please, you know what this is?
What's that?
Um, it's when one's mood, change as a result of certain stresses that they encounter in life. And from what I'm seeing, I can attest to the fact that you've been through a lot, and you've had your dog dying, your spouse also, dying, and you having some confrontation with your son. I'm actually suspecting that you might be experiencing something like that. Um,
Why I'm feeling
however,
upset, doctor?
sorry.
Why I'm feeling upset, doctor? Like, is it normal, do you think?
Well, I actually think that it's normal to be upset, because I mean you have people that have been close to you, your daughter, your spouse, your dog. So it would be normal to react that way. However, um, I would like to assure you that sometimes it's I don't even know what to say. Sometimes it's difficult to adjust to certain things after it's been taken away from you, and also it could also be as a result of what you're experiencing can also be as a result of you having difficulty to grieve about maybe the situation that you find yourself in. I don't know if you get me so far.
Anything else that I need to know, doctor?
Yes. So with this, I think I would want to involve a clinical psychologist to help you in dealing with how to adjust and also how to grieve properly. Also to call in some support from other family members to help you in this situation. I don't know if you have any other family members around aside your son.
Okay. Anything else?
Um, no, doctor, I actually don't know what to say.
Okay, that's okay.
So
So
sorry.
I will discuss the case. Yeah, it's a psychiatric case. So your predominant assessment area is you need to counsel your patient showing more empathetic attitude. Here, history is not your task. So basically, you need to mention about the diagnosis. I'll discuss that case. So this is actually coming in a like role player might give you different type like positive things. So based on the positive findings, your diagnosis will be you can explain. So here, my most likely diagnosis, I'll say. Let's discuss the case. You are at a GP clinic, 75-year Sonia going through some emotional problem. Her dog died 2 months ago, daughter died 2 years ago due to leukemia, and spouse also died like 30 years back, no suicidal idea, having sleep issue, no nightmares, no flashback, had a fight with son, and he refused to take care of dog. And recently, like patient complaining about feeling emotional, upset, so task is diagnosis, cause for our emotional response and further management. So this case, based on the positive finding, it could be due to adjustment disorder or acopia, or it could be due to like just a grief reaction. If you notice there is like definitive stress positive, like stress or positive, it could be acute stress disorder as well. Okay, so three different things you can consider. As I mentioned, like it could be just a grief reaction because dog died recently, and that could be the like feeling emotional and just had a fight with son. Another thing could be adjustment disorder because now patient is really like lonely. Previously, she lives with her dog, but now so there could be the adjustment issue or acopia, and it could be like stress disorder as well. Okay, other differential lifestyle stress, emptiness syndrome, or like depression. Okay, so here, if your task is history, take the history. Like definitely, your main approach would be showing empathy and rapport, confidentiality, history of presenting complaint, ask details about emotional outburst, anger, poor sleep, poor concentration, or any other positive findings, ask details. But remember, in this case, history not your task, so you can skip. But if history come in, just ask details. Psychosocial history details, head assess, SADMA, past medical, family history. Okay. And just a key point in this case, diagnosis and management. So explain about normal grief, reassurance, offer support, psychologist for counseling, and sleep hygiene. Okay. So if history or task, so take a short history regarding psychosocial history like mood, sleep, appetite, interest, home situation, any stress at home or work, anything happened recently that can make you really stressed or upset, because our aim to rule out adjustment disorder. Are you generally anxious person, panic disorder, worried about having another attack, past medical surgical things, family history, asking. So difference between normal grief or like depression, because like emptiness could be one of the predominant affect feeling, like emptiness and loss like accompanied by occasional pleasant emotion. So if depression, so patient will tell you all the time depressed mood. Okay. uh, but on the other hand, for normal grief, you can ask like, do you feel all the time like depressed, or do you enjoy the thing that used to do before? So in that case, patient like concentration, energy that can be preserved, and also like patient can still have hobbies, pleasant emotion can still have. Um, okay. Uh, your patient can maintain like social connection with family friends for normal grief, but on the other hand, for depression, your patient more wants to stay like alone. Okay. And thoughts for normal grief, like thought could be preoccupied with memories of that deceased, and that could be the reason for tearfulness. Okay. But on the other hand, for depression, most of the time patient can do like self criticize, like thought of feeling guilt, hopeless, like those things. That's why like there could be very fine line between depression and normal grief. But in this case, like based on the positive findings, if my patient mentioned to me, like my patient is emotional teary, most of the time, like just thinking memories of deceased person or like dog. So in that case, I can say it could be just a grief reaction. But if patient is really upset because at this moment patient is living alone, no one is here to be with her, and patient also had a fight with son, so that could be the stressor, patient cannot cope. So in that situation, I would say your diagnosis would be adjustment disorder. So just listen carefully to your role player positive findings and you can make a diagnosis. As I mentioned, so 2 or 3 important differential, I'd say it could be grief reaction, it could be adjustment disorder or acopia or stress disorder. Okay. So explain that it is an emotional response for a stressful event, and I can understand that you are having a very hard time to cope. Other reason could be anxiety, depression, any infection, but those are less likely. So what I can do, I can refer you to the psychologist for talk therapy, and they can advise you some relaxation technique, deep breathing, meditation, yoga, and you can advise for SNAP approach. Okay, provide your patient reading materials about grief, about adjustment disorder, and definitely provide the red flag regarding any suicidal thought, harm to yourself or harm to others. You need to come to immediately to the hospital. Okay. um it is usual thing that we feel really sad when we lost something, and this is just normal and acceptable, because and that could be the reason you are feeling low, upset, tearful, emotionally like upset. Our body and mind like interact relatively. So when you are feeling sad for that lost person, you can be easily being irritable, easily provoked, okay, and easily feeling upset. And let me assure you that the feeling will go away spontaneously, and it is like an injury, and that needs some time for full recovery without a scar. Okay. I do believe that you feel better soon, but I will review you like next week as well. So just mention. Dr. Gayatri, as I mentioned, like just have a few differential in your mind, and not be very like having tunnel vision that it could be adjustment, because just listen carefully to your role player positive findings. Uh, for me, I noticed like uh, different candidate mentioned different positive findings. Okay, so either it could be normal grief or it could be like adjustment. So as I mentioned, for adjustment disorder, if your patient mentioned that patient feel more lonely, and that could be cannot cope, and also had a recent fight with son, cannot communicate with son. So that could be the reason for adjustment. But if patient thinking about memories about the deceased person or deceased pet, so that time you can think it could be just a grief reaction. Okay, so yeah, that's the case. So let's move to the next one. Dr. Anuj, are you there?
Hi, hello. Yep.
Hello. Okay, your 2 minutes is you don't need to ask about physical examination findings. Okay.
Hello, can I start now?
Yeah, you can.
Okay. Hi, hello. I'm Anuja, one of the ED doctor.
Hello.
Yeah. How can I help you? What happened?
Hi, doctor. I'm really worried about my son, doctor, because Joey just accidentally, doctor, he ingested some washing detergent just a few hours ago, doctor.
Oh, sorry. Sorry to hear that. Yeah, let me just have a look at the baby. So, yeah, when did it happen?
Maybe like 3 hours ago, doctor.
Do you know which detergent or which one was he ingesting and how much?
Just a liquid one. So, can you hear me?
Yep. Do you know how much he took?
I'm not sure. Maybe 1 spoon or like more than that. I'm not sure, doctor.
Okay, was there any vomiting or any distress you could notice after that?
Yes, doctor. He did vomiting like maybe twice already.
Okay, and how is he after that? Is he active according to you?
He's crying a lot, doctor.
Okay, yeah. So let me just have a look at your baby. I'll check his vitals and I would like to examine his oral cavity, the mouth and throat to see
Okay.
for any burns that happened from the ingestion of detergent.
What's that?
I would like to check the blood pressure, his blood pressure, heart rate, and everything, and the oxygen saturation with the baby.
Okay, you can proceed. Your patient vital is stable.
Hello.
Can you hear me?
Yeah, I can hear now. Sorry.
Hello?
Hello. Yeah, sir. Sorry, something is going wrong. Can you hear me?
Yes, I can hear you.
Okay. Yeah, I would like to examine the baby to look for the vitals and the the mouth to look for any burns?
Okay, sure.
Okay. Yeah, so yeah, from the history, it looks like he accidentally ingested some detergent. So the detergent has a property of burning your like wherever it goes, it can cause some burns. And so I would like to examine his throat to look for any burns or anything. And I'll keep the baby under observation and give some fluids, and I would like to do some blood test on him and put an IV cannula, and I would like to involve my senior also, and also take an chest x-ray to look for any aspiration or anything. Like sometimes when the vomiting can occur, it can cause some regurgitation into lungs, which can cause some infection. Okay, are you getting what I'm telling?
Anything else that I need to know, doctor?
Sorry.
Anything else that I need to know?
Like, so the baby will be under observation and we'll review him. Yeah, so sometimes it can cause severe burns to the mouth and your food pipe, and sometimes it can cause dehydration. The baby might get dehydrated like that, so he definitely need close observation. So we'll be keeping him in ED, and I'll involve my senior and the pediatrician also. Okay, so don't worry, we'll be taking care of your baby. So we have a good team here.
Anything else, doctor?
Uh, yeah, I think we will take care of your baby.
You want to stop?
Yeah. Yep.
Okay. Dr. Anuja,
Yep.
did you have a study partner?
No, not at the moment.
Okay. Try to find a suitable study partner, okay? So
Okay.
for any case, you need to know the proper structure about history taking. So your patient basically came here because of accidentally ingested some washing detergent. How we started your history, that was really nice. You need to ask about either that is the liquid or the like powder one. That was absolutely correct. But ask more, like, do you bring that detergent and how much? You already asked me. Now coming to the severity of that, so ask about, you already asked me about vomiting. Apart from
Yep.
vomiting, you should ask about short of breath, noisy breathing, cough, turn pale or blue, like detailed systematic feature you need to ask. Okay.
Okay. Okay.
Then ask about other birth history very quickly, patient general health history quickly, social history, because you need to rule out it's not a non-accidental injury as well. Okay.
Okay.
So physical examination, definitely online you will get PFE card. So most of the time PFE card it will showing like is normal. So your task is management. So always remember management. That means you need to mention about the investigation, immediate and long-term management. So investigation for this is what we are going to do, or do you do only just observation at this moment, then management? Okay. I'll discuss
Okay.
that so that you can understand.
Okay. Thank
You
you.
have
Yeah.
total whole 8 minutes. You need to talk to your patient that total 8 minutes. Okay.
Okay. Yep. Okay. Thank you. Yeah.
You are a HMO at ED. You are going to see a 16-month-old baby boy, Joey, brought by mom, Lisa. So he accidentally ingested some washing detergent few hours ago. Your task is taking his PFE card management. So vital stability that will be given on the stem. You need to ask like details that is either a liquid or washing detergent. You can ask your patient, did you bring that detergent with you? Do you know like how much your baby took that one? Have you done anything after taking that detergent, any irrigation with water? Did you give him anything like water after that? Ask about severity. So ask about breathlessness, noisy breathing, increased breathing rate, color, like any turn pale or blue. How about like pain, nausea, vomiting, drowsiness, drooling of saliva? You should ask. Bindsma, social history, ask about, because you need to rule out that is not a non-accidental case. Physical examination, you will get PFE card, and most of the time it will be normal. But if anything abnormal, you need to explain. Okay. Investigation finding. So investigation as per the RCH guideline, they mention it like usually we are not going to do any investigation if there's the asymptomatic case. If asymptomatic, so observe trial of oral intake at 4 hours after exposure. And if that is like no symptoms, low suspicious or likely benign ingestion, after discussion with poison information center, you can discharge the patient. But investigation for the first instant we are not going to do if that is asymptomatic case. But if it is symptomatic case, and if you notice there is systemic feature, definitely you need to order all the bloods, ABC, UVC, VBG. You need to do liver function test, kidney test, and also X-ray as well. Okay. As per the acute management, as per the RCA's guideline, they mention for if any symptom, you need to admit for endoscopy within 24 hours. Okay, so in that case, nil by mouth, commence intravenous PPI. If you are not in the tertiary hospital, you need to refer this patient to the tertiary hospital for pediatric surgical review. Okay, but if it is asymptomatic case, so just fluid observation, nothing else. Okay. And definitely activated charcoal, those are the contraindication. But investigation wise, if symptomatic, you can order like blood test, X-ray, endoscopy within 24 hours if there's a high suspicious for GI injury. Okay. And you need to contact with Victorian Poison Information Center as well. If asymptomatic, you are going to advise your patient um, about observation, trial of oral intake at 4 hours after exposure. Okay. And if it is low suspicious for GI injury, after discussion with Poison Information Center, you can discharge the patient. Okay. Who will be the last person? You can mention simply like 250 ml maximum fluid you can advise to drink. If asymptomatic, we are going to treat with oral fluid dilution. But it depends, okay, how your patient responded. So let's move to the next case. Who wants to perform? Okay, Dr. Govinda, are you there?
Hello, doctor. Yes, I am here.
Hello. This is your case and your 2-minute research now. Hello, doctor. Sorry.
Okay, so it's time. Okay, so shall I start, doctor?
Yeah, you can start.
Hello, I am Dr. Govinda Bandari. I am one of the doctor here. So how may I address you?
Hi, doctor. I'm Luke. You can call me Luke.
Okay, Luke, nice to meet you. So from the notes, I can see that you are suffering from a bloated feeling in this abdomen, and usually after meals. Is that right?
Yes, doctor. Actually, after meal, I'm not feeling comfortable. Like on and off, I'm having tummy pain and some distended tummy, bloated feeling.
Okay, Luke. So now we are going to discuss about your case so that we can personalize treatment for you. Okay, is that okay, Luke?
Sure.
So whatever we will discuss here will remain confidential unless it's harmful to you or others, Luke. So you can share all the information with me. So Luke, so before going deep to the this your symptom, like I have to ask you some question. Is that all right?
Okay, doctor.
So Luke, you said you have a bloating feeling in the abdomen. So what do you mean by bloated feeling, Luke?
I don't know, doctor. Like whatever I'm eating, immediately I feel like bloated, some like distension.
Okay. So yeah, how many? It's been since how many days?
Maybe like 1 or 2 months, doctor.
Okay. Like in those 1 or 2 months, like are you able to eat properly? So are you eating properly in this 2 months period? Are you able to eat properly?
Yes.
Is there any problem while taking water or solids?
No.
No. Okay. So, Luke,
Mhm.
you said you have a pain, abdominal pain that comes and goes away, right? So, does the pain started gradually or it started suddenly?
It comes and goes, doctor. So maybe like it just started like gradually.
So, where is the location? Can you point out the location?
It's my upper tummy, doctor.
And does that pain goes to somewhere else? Like it started in your epigastric, that in that upper tummy. Does it shift to other part of the body, like back or downwards?
I didn't notice it.
Okay. And does it disturb your sleep or not?
No.
No. And at the moment, do you want me to give some painkillers to relieve your symptoms,
No,
or it's
doctor.
okay?
I don't have any pain at this moment.
Okay. Do you have any nausea and vomiting during this period?
On and off, I'm having nausea.
Okay. And how is your bowel and bladder?
It's okay, doctor.
It's okay. And do you have any weight loss, loss of appetite, and lumps and bumps in the body?
No.
Okay. And do you have like, did you notice that you have a bit difficult to flush toilets or any black staining in the toilets? Did you notice like something like that?
No.
No. Okay. And okay. And do you smoke, Lucas? Do you smoke or drink alcohol?
No, doctor.
Or have you been taking some this painkiller medications in like a few months back or around this time? Are you taking any painkiller medications?
No.
Do you have any past medical history or any surgical histories?
No, doctor.
Do you have any allergy to some medication or something like that in the past?
No.
Okay. So how is your okay, it's okay. So I would like to go to the examination now.
Abdomen findings is normal.
Okay, everything is normal. Okay. Here. Okay, let's proceed to the next. They have not done upper GI endoscopy. Okay. Let's call this one up this time. Okay. Now I would like to go to investigations. So there is no okay. So most likely diagnosis. Okay.
You can
Luke's,
order investigation.
okay. So Luke, I thank you for all the history that you have given from history and examination. So this time I feel that your all your examination is all normal, but also we should think about many cases, right? Because you have many causes, because you are feeling you have been suffering from this problem since 2 months. You are having pain off and on. So and you also had a nausea, vomiting at the time. So I'd like to order some investigations. I would like to order renal function test. I would like to look for the urea, creatinine. I would like to investigate the urine routine examination and microscopy and culture. I would like to do stool routine exam, REME, and I would like to do stool culture as well at the same time. But because of your age, Lucas, I have to think about some more problematic things because of her age. So I would like to have to do some investigation like upper GI endoscopy. It is a test that is not painful. So, but it is a bit special test, but it's not that painful. Specialists will do it very nicely. So from all those things, I think you are just having a problem of like peptic ulcer disease. Do you know? Have you heard this term before?
What's that, doctor?
Okay, it is the just the we have this is the gut, and in this is the stomach, right? This is tummy. So inside tummy we have a lining that protects the tummy from acids that is present inside the body. So whenever this acid production becomes more, it could be because of any stress, or it could be because of infection like H pylori. There is a bug named H pylori, or it could be because of some painkiller medication. Although you have not taken, but it could be because of that also, and it could be because it could be caused sometimes by alcohol as well. It may lead to the erosion of that barrier protective layer, and which can cause pain in the abdomen after eating meals. So I want to rule out other big problems as well after while doing endoscopy, and I want to do ultrasound of your abdomen as well. I want to look if there is any growth in the abdomen or not. I want to do barium meal study because I want to see if your esophagus, your food pipe from mouth to the stomach is okay or not. So I would like to do all those investigations. So most likely diagnosis is peptic ulcer disease, but other diagnoses are like pancreatitis, like there is something called pancreas in our tract that is mostly responsible for producing digestive enzymes. So I'll also look for that. And I will also want to look for any stones in the gallbladder. That is a part, that is a storage in the, is a part of liver. There is storage which stores the bile things in that. So I would like to also investigate that. So I would like to do these investigations. Are you with me so far, Luke?
Yes, doctor.
So do you have any other questions or any concerns that you want me to ask?
Anything else that I need to know?
Can you please repeat your question, Luke?
Anything else that I need to know, doctor?
Here, okay. So, but you should always think about some red flag sign
Your
that
time's
if
up.
you see. Okay.
Okay.
Yeah.
That it was really nice performance. Like you took a very broad history. That was nice, and you told me like lots of management plan. So as a junior doctor, we are always like thinking about, yes, your differential peptic ulcer, it could be one of your differential, but you can think about like gallstone as well. So your patient gives you positive findings about blotting sensation, postparental like blotting, pain, and also having like pain coming and going. You can think about ulcer if there is some bitter taste of mouth, like reflux issue, or history of taking any trigger factor for ulcer. You didn't ask me any stress. Tea, coffee could be the trigger factor for ulcer, smoking, but those are less likely in here. So peptic ulcer could be one of your differential, but here most likely reason for this patient is a biliary colic. Okay. I'll discuss this, and I'll tell you why I'm thinking it's a biliary colic. So your next patient in GP is a 56 years old Mr. Lucas, who has suffered from a bloated feeling in his tummy, usually after meals, and pain coming and going. So task is his TP. If he discuss the most likely diagnosis with the examiner, appropriate investigation, and the management plan. So here, there are like lots of differential. It could be like any upper, epigastric pain, right upper quadrant pain. So epigastric pain, it could be due to peptic ulcer disease or like gastritis. Sometimes also like biliary colic pain, patient might feel like um, upper tummy. So you need to specifically ask, is it middle of your tummy or is going to the right or left? Ask about it. So right side pain, it could be biliary colic if pain is intermittently coming, going, not constant. Acute cholecystitis, severe pain, chronic choledocholithiasis, any pancreatitis. Even it can cause like pneumonia, less likely like lower lobe pneumonia. But those are the reason for upper abdo pain. In here, ask about associated features. So basically pain is started after meal, and that things happen for a couple of months. Nothing really makes it worse or better. Patient didn't take any Panadol, and patient didn't have any past medical history, non-smoker, no other significant history as well. Physical examination findings is unremarkable in here. So when you ask about abdominal history, ask about associated symptoms like nausea, vomiting, urinary symptoms, bowel habit question, other differential. Cancer could be the reason because patient already more than 50. You need to ask about any loss of weight, loss of appetite, lumps, bumps. So how doctor asked me, that was really nice. He already asked me about Dr. Govinda asked me about cancer history. Like his history was nice. Most of the question he asked, that was nice. Physical examination normal. So investigation wise, all blood tests we need to order. Like all blood test means routine blood test as a junior medical officer. So ABC, UVC, LFT, kidney function, you can ask. If you are concerned, you can do imaging, like best investigation, it would be abdominal ultrasound, or you can order CT scan. But before ordering CT scan, you need to discuss with your senior as a junior doctor. So my most likely diagnosis here is it could be incidental gallstone. That could be the reason for your patient having bloating feeling and intermittent abdomen pain. Okay, because 70% of people with gallstone are asymptomatic but become symptomatic over the year, and they can give us all the positive finding like bloating, indigestion feeling, um, along with right upper quadrant pain. Um, okay, so what happens if we are not going to treat it? That can cause possible complication, like cholecystitis can happen. Okay, acute cholecystitis, obstructive jaundice, cholangitis, pancreatitis, those things can happen. And the management. So if it is a biliary colic, you can get surgical opinion and just wait and watch. But we need to first confirm the diagnosis. And as I mentioned, it might have any complication like cholecystitis, cholangitis. So definitely for cholecystitis, surgical opinion. Cholangitis, same for surgical opinion if that's the reason for obstruction. And for cholangitis, patient needs antibiotic. But for pancreatitis, patient usually doesn't need antibiotic. So you can mention about it. For if you notice that is asymptomatic gallstone operation, if that's the reason for inflammation like acute cholecystitis, we can talk about operation, but not now. If your patient asks, you can explain details, but just mention like, look, if we need a notice like that's infected or inflamed, that time we can go for surgical option. So in this chart, it's showing like when we can call biliary colic acute, chronic, or cholelithiasis. You can, based on that, what investigation we can do. Okay. So just explain to your patient based on your history, physical examination, I'm thinking you're just having a gallstone. And this could be like a small hard stone, probably composed with cholesterol, usually that developed in the gallbladder. And it is a common condition, and these are the ones that form in the tummy. And gallbladder normally collect bile, and which helps in our digestive system. Okay. And that bile gets precipitated in the gallbladder, and that leads to the formation of a stone. As I mentioned, complication of the gallstone, what can happen? At this stage, your gallbladder is not inflamed, I think. So we can wait and see. Okay. But it is also important to get that gallbladder removed with the stone because that can cause complication. That can cause cholecystitis, cholangitis, pancreatitis could be the reason. And as I mentioned, treatment option, surgery. Okay, so that surgery can be either laparoscopic or open surgery. So I would say my most likely diagnosis here is a biliary colic. But other differential, you can say it could be gastritis, peptic ulcer, but less likely. I couldn't find any trigger factor for peptic ulcer. There is no reflux, no taste in mouth, no patient non-smoker, so that could be less likely.
Okay.
Okay.
Okay, thank you so much. And just I have one question here. Like when they give us a upper tummy, like we should ask him which side of the tummy also, like in online exam.
So in that case, like if you ask like, do you feel is more on the central or like more on the right or left? So that you can divide it your differential in your mind. Okay.
Yeah. Yes. Thank you. And so I asked one question like, is it related to back or down? But
So more like definitely always remember it's not MCQ, it's a clinical. You will not get all the positive findings.
Okay. Okay.
Okay.
Okay. Thank you
Like
so much.
it's not like classical feature you will get all the time. It's not like that. But because it's a clinical diagnosis, you can say like, look, most likely it could be stone on your gallbladder. So if it is coming to the duct, it can cause pain and it's coming back. So pain resolved. It could be the reason.
Okay. Thank you so much. Thank you so much.
Okay, so that's all for today. Thanks for attending the class. I'm trying my best to discuss with all the recent cases, like the case which comes like frequently for last few months. Um, Yes, Dr. Nadim, I can totally understand your situation. So what happened for the beginner? My advice will be like, don't need to worry for that role play session because our role play session, when we discussed, that's how MC clinical exam like happened. Like you will get like random cases. But for the beginner candidate, my suggestion would be go for theory cases first. So when you are doing theory cluster, you know about system-wise approach. Okay. For example, how to take a history for medicine, ONG, how to take a history for PEDS, how to take a history for like psychiatric case. So just go through first the theory notes. Um, you will have that cluster-wise approach so that you can also know the case and you can have like good differential. And after 1 to 2 months, when you already familiar with this, structure with cluster, it will be much more easier for you for that role play session because like I am discussing that random role play, and in your main exam you will get that random cases. Okay. I know initially it's really overwhelmed, but my suggestion would be find a suitable study partner, start theory cases fast, like cluster-wise approach, work on your structure first, and join definitely role play session so that you can also have an idea how the case is coming in the clinical exam. Okay. Um, those who already booked exam like next 4 to 5 months, fast find a suitable study partner. Not only one, like find a suitable partner, at least two or three study partner, and start your cluster-wise approach fast. Please read the handbook and every day like 1 or 2 hour like you can do that role play or like random role play, like when you have your cluster and structure you can start your role play uh, like random role play as I mentioned. Any question for today's cases? I tried to explain as much as I can. Hope you understand, guys. Um, and I was discussing all the sample cases. So if no questions, so we can finish today. Thank you, everyone. Good night.